Hello, podcast listeners. Welcome to today's CAHL podcast. The California Association of Healthcare Leaders is an independent chapter for the Northern and Central California region, chartered by the American College of Healthcare Executives. CAHL serves healthcare executives in 50 of California's 58 counties, and our vision is to be the premier professional society for healthcare leaders in our region, advancing healthcare excellence and healthcare leadership, and improving the lives of the communities we serve. These podcast episodes are meant to provide thought leadership on numerous healthcare topics from our CAHL members and their allies. Today, we welcome Graciela Soto Perez. She serves as the CEO of Altura Centers for Health, formerly known as the Tulare Community Health Clinic. It's a federally qualified health center dedicated to serving the underserved and the uninsured population in Tulare County. Graciela's commitment to the mission is deeply personal, as she herself experienced similar struggles growing up as a migrant farm worker. From a young age, Graciela worked alongside her family harvesting olives, grapes, and oranges year-round. Despite these challenges, she excelled academically, becoming a certified nursing assistant and a home health aide in high school. She furthered her education by earning a business certificate from the Tulare County Organization for Vocations Education Program, followed by a BA in Public Policy Planning and Development with a minor in Healthcare Administration from USC. Graciela went on to earn a master's in Health Administration and Gerontology from USC, reflecting her dedication to healthcare leadership. She's been an ACHE member since 2001, and she initiated a Chicano Studies at Woodlake Union High School, driven by her passion for educating others about Mexican-American history and inspiring future generations. Welcome, Graciela, to our discussion.
Hello, thank you, Michael, for having me. I'm really honored that you've chosen me to have this conversation. I really enjoy it.
I'm really excited as well, Graciela. So, Graciela, how do you define authenticity in the context of healthcare leadership, and why is it important for you?
Authenticity is very important to me now. When you brought up this topic, I did some research and I feel like I'm very fortunate, especially in this sector of healthcare industry, as a federally qualified health center and the mission of the Bureau of Primary Healthcare, which is under HRSA, and our organization is just hand in hand. It is so easy. Authenticity is more being true to oneself, self-awareness of oneself, and the upbringing and the mission of both just come hand in hand. Is just that compassion. So I feel like even being in a hospital, any kind of healthcare setting, authenticity matters and is very critical to have because of the compassion. You could have a passion for many things, but it's the compassion, the healing process, and the ultimate goal of improving people's quality life, providing access, and at a qualitative matter. So I feel like they go hand in hand, but ultimately it's self awareness and being true to oneself. And why is that coming easy for me in this sector? Is because our goal is to treat and improve the healthcare of the underserved, uninsured, and now because private offices are closing, it's the whole population taking care of everybody. But ultimately, it is improving the quality of care, and I feel like it goes hand in hand with my upbringing. Along with authenticity, it's morals and transparency, and that's very crucial as well. And I think they all goes hand in hand, and it fits perfectly with working in an FQHC.
So when you, like you said, you were born and raised in the area, a lot of times when people get their education, they'll move away as much as they have that intent to stay within the communities. And you've chosen to come back. And so tell us, I'm sure you've had many opportunities to be able to go other places in the United States, and you've chosen to stay in this community. So tell me how that authenticity fits with that in terms of you deciding to stay instead of go somewhere else.
Being at USC, I did have the opportunity to go and stay in Southern California, but all of my family was here in the Central Valley. I'm from a small little town called Woodlake in the foothills of by Sequoia National Park. Very beautiful there. It's peaceful, it's quiet. We don't have the big universities, but we do have a lot of warmth, welcoming, passionate, and there's so much to do here. There's a lot of lack of resources. I feel like I was able to make a better impact in this community than I would anywhere else. And being at age 26, I was 26 when I became the CEO of this company, of Altura Centers for Health, back then Tulare Community Health Clinic. This clinic was started by the hospital here locally, but they sold it. And so this FQHC became independent back in 1998. So how does the authenticity place? When I first started here, we were just one clinic. We were FQHC only. We didn't receive any special funding. Now, Burr Primary Healthcare has different pots of money you can apply for. One
Mhm.
of them is the migrant money. And so we apply for the migrant funding. This is a large area where there's a lot of migrant population, and this funding could help us outreach and improve the healthcare in that sector.
Mhm.
And so where does it come in handy? Again, because of my upbringing of following the crop. Migrant has nothing to do with immigration. It means that you follow the crop from season. It's a seasonal
Right. Right.
situation. Even if you for a dairy, you can qualify nowadays for seasonal migrant farm work. So just that. So now we receive money. We receive additional money through migrant funds, and we are able to better assess and address the population as well. So that's where the authenticity is. You can shine and help when you can relate. Also, not only that, but culturally. In the Central Valley, we have a high Hispanic population, mostly of Mexican descent, and I am of Mexican descent. And so that also helps. Now, what was migrant back when I was young versus now is different. So we continue to learn. You continue to be part of these associations, just like being part of ACHI. You constantly learn skills and resources. It's not only being self-aware, but also bringing in those skills.
Sure. So why don't you share with us a personal experience where authenticity as a healthcare leader made a significant impact on your team or your organization? And there may be individuals that aren't as familiar with FQHCs as other healthcare parts, and maybe you can help them to understand more as you share your story.
Well, as I had mentioned, my background, daughter of the immigrants in our community, I feel like the personal background has brought that. Um, Also, but of course, the clinical portion, the cultural is also the language. And here in Tulare, there's a high population of Portuguese, so I'm now learning Portuguese, and I feel like the experience that's here with being an FQHC and working at the clinic is what's helped us. Um, Again, being true to oneself and also hiring the team. You can't be successful if it's just me. I know we're leaders because of our titles, right? You're a CEO, you're the title. However, there are multiple leaders in the organization that impact the outcome. Your CNO, your chief nursing officer, your chief medical officer, your chief information officer, your if you have a chief operating officer, your chief financial officer, they are all responsible for different sectors of the company to be successful. But they also have to have that authenticity because me alone, it won't work.
So,
We all
so
have to
talk,
have
so
it.
talk to me about that with your team. Leaders approach things very differently. So how do you support your team? What are some of the kinds of strategies or efforts that you pursue with your team to be able to make them not only want to come and work with you and the organization, but stay as well?
Yes, and it's not just the team, it's also the whole entire staff. So the because patients have the day-to-day interaction with the people that they see at the front, right? So when you that touch with the call from the call center, that touch when you come in, the receptionist, nowadays more and more technology, right? So some people don't even see that receptionist, but I feel it is important that you still have that touch. So how do we support our leaders? I support my leaders in, first of all, it starts with the interview process when you hire your team, that they share the same mission, the same values as the organization. If there's not a right match, then it won't work. It won't work for the community and won't work for the organization. And so upon hire, you take the time to spend time with in the interview process, during the tour, take them out to lunch, and you get to know people start opening up. And so that's how I decide, okay, this is going to be a good teamer. And luckily, we don't have a huge turnover. And so our team member, I would provide them with the skills, support them by joining in membership to organizations that are going to help them improve their skill level, such as, of course, ACHI is a good resource. Also, those that are like the California Primary Care Association for us in the country, there's different PCAs, but for us, it's the CPCA, and become membership. Support them in growing, grooming themselves, being stronger, but also always being true to themselves. I always tell them, lead by example. How I am flexible with you, I also expect for you to treat your employees the same way. The titles are important, but leave those at the door. That human interaction. That's just critical. And our team is pretty much aligned with that. Well, for example, we have a chief nursing officer, and we went to go see one of our congressmen go present. And I looked around at the end, and where was she? I looked, and she was helping an elderly lady get out of the chair. And that compassion is really stands out. That's not something that you can teach. You either have it or you don't. And so that's, to me, that's pretty amazing. So our team is pretty much, we share the same mission. Again, just everybody make the mission simple. Everybody know it, continue to re-emphasize it. Why are we here? Our mission is compassionate quality healthcare. That's pretty short, it's brief, anybody can know it. Again, passionate people are passionate for many things, but compassion is really what makes the difference. Ethics, transparency.
So when you talk about leading by example, as someone who's coming in and, as you had indicated, interviewing for the first time, leading by example may mean different things to different people. Are there specific things that you can share with us of what you'd expect in terms of leading by example?
Yes, for example, an employee may say, I have my daughter is getting an award tonight. Can I leave early so I could go see my daughter receive the award? I let my team give them that flexibility to go see their children receive the award, even though it's the working day. So that kind of flexibility is like you do the same for your employees, and they will value that because they also need a balance. It's not just work, work, work. Although we spend most of our time at work than we do at home with our own family, but you also have to treasure the life and their quality of life and have family as well, family time. And they appreciate that. They appreciate that flexibility and that you respect that they have a family at home and you allow them to be part of those rewards that of their own family members.
Sure. Thank you. Many organizations, as they're coming out of the pandemic, they really struggled during the pandemic. In addition to, there was a tremendous amount of turnover, a lot of burnout, and it was just difficult to be able to recruit people so that people that were staying and working were filling a lot of vacant spots. And it was just really hard during that time and currently as well for certain positions. How do you deal with that with your staff in terms of maintaining that authenticity when people are frazzled and frustrated and just worn out?
We embraced technology a lot during COVID-19. We were one of the ones, the clinic, because we received HRSA funding. HRSA did give us vaccines for COVID, and we worked with our county as well. Tulare County was very supportive, We collaborated, we shared some nurses to help us provide as many vaccinations when they were holding those events. But I did tell our team here in administration, they could work hybrid when they were sick. However, I did tell them, if our clinical team has to come every day, there's no reason why we couldn't. We use the protections that were given to us. We had the N95 mask, we had the sterilization. I mean, we had everything accessible, and we tried to do everything by phone, by Zoom, GoToMeeting, Teams. We used everything we could, and we all still came to work. Now, anytime anybody caught COVID, they stayed home, but we did a hybrid. Now, the nice thing also during COVID is even with patients, for the first time in history, California let us bill for telephone visits, right?
Right.
So that really helped because even the provider can work from home with isolation if they weren't really sick,
Right.
but they could still get everybody else. So again, that's embracing your technology and how you work. But that again, with lead by example. If you expect your MA to be here and you're the CNO and you're home while your staff is working, you have to set, if they see that you're still coming just like them, they're more likely to value. And when you tell them something, it's not do as I say, not as I do. That's very
Yeah.
important that you set a good example, and that's a culture. That's really a culture that has developed. And I actually had no issues with everybody in the team. They all came to work. The billing, everybody came to work. But I also came to work. I came to work every day. Start from the
So,
top.
so you've been in this organization for 20 years. How has the leadership changed over those 20 years? Because again, we're lifelong learners, and some of the things that maybe we did 5, 10, 15 years ago, we would do differently today. So what are some of the lessons that you've learned over the years to be a more effective leader in working in this organization?
Oh, yeah, there's definitely over 20 years of working for an FQHC, which I feel very fortunate and blessed to work for an FQHC, the mission of the facility. But a lot of lessons learned back in the day. So Tulare County is one of the highest poverty areas in the state of California, highest poverty. We have the highest Medi-Cal. And so back in when I first started, there was no Affordable Care Act, and we had a high number of uninsured patients. So what does it mean when you have a high number of uninsured patients? That means you have less revenue. And we live in an area where we don't have philanthropy, we don't have givers. It's very low, limited resources.
Mhm.
And we also have one of the lowest prospective payment system rates in the state of California, in the hundreds. We still do. And so, how do you work with that? So, we have to get creative in how you maximize your funds. So luckily, as an FQHC, that difference between, there's different levels, and we are a nonprofit FQHC, and there's lookalikes, but they don't get the grant money. The
Right.
FQHC gets the grant, so that helps, and the rate of the medical helps. So here I am making, who do I pay? You have to pay your employees, but when you lease all your properties, back then we were leasing our properties, it's like, okay, who do you're you're working from month to month with money that you're just making it stretch. And so that's when I decided, you know what, we're gonna stay in Tulare. We're not gonna go anywhere. We should really save up, reserve to buy our own property, and that's what we did. And
Mhm.
so now I don't. And being in Tulare County, being nonprofit, you get a tax exempt because when you lease your property, you have to pay for the common area expenses. The lease goes up every year, never goes down, and you have to pay for their property taxes. Could be 35,000 or more a year. I mean, it just goes up. For us, that's a lot of money and resources that we could be putting into ourselves. So that's when I started to purchase our properties, and we still lease a couple locations, but slowly we've been transitioning. We bought 10 acres, and we're finally building phase one where we can transfer some of the services. But those are some of the things that's survivable. Now fast forward, we had the Affordable Care Act, and now patients who didn't qualify for Medi-Cal, such as men or women that don't have children. Now they qualify. And now, as of January of this year, uh, Governor Newsom approved legislation where even undocumented qualify now for medical if they meet the criteria. And so now with minimum wage, that's now a new, there's always something changed. There's always something new. But so those are the challenges. So you learn to survive. You find ways to bring in the income, which affect your decisions in the future. So that's one of those decisions that affected us is now we own almost all of our property. All eight we own except for one.
Many healthcare organizations have been trying to work through health equity. As they look at diversity, inclusion, and health equity, they're trying to figure out what are some of the things that they're doing. You very much, as a federally qualified health center, have been the center of health equity. Are there any particular programs or initiatives that as you're getting ready to build this new facility that you're, as you had mentioned, expanding to undocumented individuals as well as others? Are there other actual programs or services that you're going to be providing in health equity as a result of the learnings that you experienced at the FQHC over the last 20 years?
So again, being an FQHC, we've always provided more than the doctor-patient relationship.
Right,
We provide transportation, a lot of outreach. We
right,
go to the schools. We provide dentistry specialty. What I mean by specialty is the oncology, hematology, the surgeons, the
sure,
different specialists that we are very fortunate to have, in addition to our core services, which are primary care,
right,
pediatrics, and so forth. Our providers, our team is already very diverse. Now it's just a matter of using the those names that we're talking about. We're having conversations at NAC, National Association of Community Health Centers, and California Primary Care Association, and bringing in that language. But we've always had to comply and work with that. So this is our community. This is our buildup. What are our providers? We taken a lot of H-1Bs, J-1s. So that's an immigration status to bring in doctors because we don't have enough doctors here. We're working with a Mexican doctor program, which will bring doctors from Mexico to be more culturally, you know, culturally aware, treat our patients who can learn their language and know the medications. So we're fortunate to have that. However, our workforce is the people who live here. That's who makes up our community. If you look at our management team and you look at our providers, they're from all over the world. I mean, we have people from Syria, Philippines. Of course, the Hispanic is really broad. We only have actually one Mexican doctor. The rest are Colombian, Peru, uh, Costa Rica, Chile, different countries, and they all bring something, but it's also very diverse. We have the language line, as we all in healthcare are required to have, and in case we have any languages we do not speak, because you might have that. So being that cultural sensitivity is something that we already have. There's always room for growth, and so it's really helpful. The more diverse, it enriches the company.
Do you have any final thoughts to be able to share with our listeners today about being an authentic leader before we end this podcast?
In healthcare, being authentic leadership is crucial. So you are true to yourself, you're happy, and the people, the vibes of your employees will feel that. And not only you yourself, but your team to also embrace authentic leadership. And I think overall, the whole organization, if they have that, and that all stems from your mission, which are probably in your bylaws, your mission and your values and your vision. Those are all very critical. Always go back to that upon hiring your employees, that they share that. It's not just about bringing in a paycheck, but actually enjoying every single day of your work. It doesn't even feel like work when you are your true self. I look forward to coming every day. To me, it doesn't feel like work. You're helping people. You're contributing to providing quality access and at affordable cost. So you can't go wrong. Definitely being in healthcare, being in healthcare is definitely enriching and an honor. I really enjoy working here.
So thank you, Graciela. This concludes our CAHL's podcast for today. We hope you've enjoyed this podcast, and we do have plans to continue providing thought-provoking insight from healthcare leaders throughout CAHL's geography. We hope that you learn something new every day, that you work to make a difference, and that you're kind in doing it.